This portion of the video is to demonstrate the evaluation of the motor system of the neurologic exam. We're going to start with a general inspection again of the patient. What is the patient's body position and posture? Are they able to maintain it comfortably? Are there any involuntary movements that the patient doesn't appear to be able to control? Next, we need to do an evaluation of general muscle bulk and muscle tone. So you can do this by, again, just looking at the different muscle areas and palpating the large muscle groups to see, is there, if you can't see it visually, is there muscle tone and muscle bulk there? Finally, for evaluating tone, we need to move the joints. So we want to use movement of a large joint. Again, just let me move your hand and your arm and just relax as much as you can. As I do the movement, I should feel a little tiny bit of resistance in the sense that it shouldn't feel like a limp piece of spaghetti, but at the same time, I shouldn't feel any changes in the movement, so it should be a nice smooth movement as I go through. I need to do that bilaterally in both the upper and the lower extremity. So again, I'm just sort of doing a general movement of the extremity. I'm going to do this again also in the knees. So just again, just relax and let me move your leg for you. And here. If you have a suspicion about a specific muscle group, make sure you test that one individually. Next, we want to check muscle strength of all the major muscle groups in the upper and the lower extremity. So we're going to start with abduction of the shoulders. So I'm going to ask you to hold your arms out to the side and then hold them against my pushing down. For each one of these, what you're attempting to do is see if the patient can hold a position against your resistance. So again, hold your arms up and don't let me push them down. And I'm testing this bilaterally. You can relax now. A patient should be able to hold against some reasonable pressure and not be able to let the arms fall. Next, I'm going to check, so that's basically the shoulder. Next, I'm going to check the elbow. We want to do these one at a time. So what I'm going to ask you to do is hold your arm up like this. I'm going to stabilize the shoulder so that the patient's only really doing the movement in the elbow itself. What I'm going to do is ask you to try and straighten your arm against my resistance. So try and straighten your arm for me. Okay, now try and bend it. I'm going to do the same thing in the other arm. Try and straighten it for me. Try and bend it. Thank you. We want to do the same thing in the wrist. If you could hold your arms up like this, and again, try and lift your hand against my hand. And try, don't let me push it down, and do the same thing on the other side. Lift up and don't let me push it down. So we've checked wrist extension. Now what we'd like to do is check hand grip. For this one, you again can do this one bilaterally, but make sure that you have the patient holding your hand from the outside so that I come in from this direction. If I come in from this direction, the patient has an easier time of being able to twist my fingers and hurt me. But I want to be able to test his strength without them causing me any injury. So again, if you want to take both of my hands and squeeze my hands as tight as you can and relax. Now again, make sure you use 2 fingers because again, that makes it harder for the patient to be able to actually cause you injury if they've got too strong of a hand grip. All right. So finally, also we want to check for finger spread. So I want you to hold your hands out like this. Keep your hands out, but don't let me close your fingers. Okay, thank you. Now I want to check the lower extremity. For most of these, we're going to have to do them one at a time. But again, make sure you compare side to side. So I want to be able to check hip flexion. So with this, I can have the patient sitting on the bed, and I can ask them to lift their leg against my hand. So if you can just try and raise your leg off the bed for me, and don't let me push it down. And now we're going to test the other side. All right, thank you. Now we're going to check at the level of the knee. So try and straighten your leg. Now try and bend it for me. And now the other side, straighten and bending. So we've done both knee flexion and extension. And then finally we want to test for the ankles. So again, I want you to try and point your toes towards the sky, lift up your foot. All right, and then the same thing, lift your foot towards the sky. All right, now push down against my hand like you're pushing on a pedal. And the same thing here. All right, thank you. So that again checked general motor strength in both the upper and lower extremity bilateral.